Hello, everyone on Facebook. Welcome to our genetics workshop. I'm Kelly Kraft, Program Manager at Gilda's Club Quad Cities. And before we get started, I just want to give a little snippet of what Gilda's Club does. We are a cancer support community that provides 100% free psychosocial support to anyone impacted by cancer. So that's a person with an active diagnosis, that's survivors, friends, family, kids and teens, and even people who have lost someone to cancer. And we do that with support groups, educational workshops like this one, healthy lifestyle activities, social events, and we're also a hub for resources and referrals. So give me a moment to make sure that our tech is working. All right, and I'm here with Jamie from Unity Point, and I'll let her take it away.
Okay, thank you.
Thank you.
Okay, I am Jamie Broline. I am one of actually the nurse navigators here at Unity Point, one of the breast cancer nurse navigators. And I also help run our Unity Point high risk program, which focuses on genetic testing and also identifying women in the community who are at high risk for breast cancer, and then providing them with different high risk screening options. So even though I specialize more in the breast cancer realm, we'll speak as I go through our presentation today, the genetic testing world applies to more than just our breast cancer patients, several cancers, as we'll get into today. So just to kind of start off with, a lot of people have the question of, how many cancers are caused by a gene mutation. So cancers usually fall into one of three categories. There's only about 5 to 10% of the population that actually get a cancer based off of a gene mutation being passed on from family member to family member. So as you can see in our pie graph that we have here, there is a larger category, about 30% of patients, which we call the familial risk category. That kind of goes into our high risk population. So if you don't have a gene mutation in your family, you may still be considered high risk. So if you've got a lot of people in the family with breast cancer, no specific gene mutation, you would still be considered high risk. And in that familial group, same thing with our colon cancers and pancreatic cancers, uterine cancers and such. And then unfortunately, the larger piece that we have here in the pie graph, about 60% of cancers are sporadic or environmental, meaning we don't necessarily have a rhyme or reason to tie down the root cause of that cancer. So one of the questions here is who qualifies for genetic testing? I have about 5 bullet points here of the main kind of red flag questions that we ask patients to see if genetic testing is something that would pertain to them. First thing, if you or anyone in your family has been diagnosed with cancer at a young age, specifically that benchmark is age 50 or younger. If you or anyone in your family has been diagnosed with more than one cancer, so if let's say you've had a breast and ovarian cancer, or a colon and a breast cancer, anytime somebody has had more than one cancer, that starts to raise the red flag. Should we look into genetic testing for a cause of those cancers? If anyone has been diagnosed, either once again, you or your family, with a rare cancer, and by rare, specifically pancreatic and ovarian cancers tend to be a little more rare. So if you've got a parent or a sibling or aunt and uncle, or of course you yourself have been diagnosed with one of those cancers, once again, we start to look to see if there's a genetic cause to that. And then if you have multiple people on one side of your family with cancer, so let's say everybody was maybe a little older in their 70s or 80s with a diagnosis, but you've got 3 people on mom's side of the family with breast and colon cancer, pancreatic tied into that, 3 people on dad's side. So anytime you start to have multiple cancers on one side of the family, even if they're not those rare cancers, or a young age, we start to wonder if there's a genetic tie to that. And then lastly, if you have anyone in your family that has a known gene mutation, whether or not they have cancer or don't have cancer, if we know that they have a gene mutation, then you would definitely qualify and want to look into getting genetic testing done for yourself. I can stop there if there's questions right away, or I'll just keep going if not.
I don't see any questions.
No questions yet? Okay. So once again, since I I specialize more in breast cancer, that's why I kind of have a breakdown aimed more towards our breast cancer patients. And also specifically, if people have been familiar with genetic testing in the past, they may have been heard of a family member that has had BRCA testing. So BRCA1 and 2 are two very common genetic mutations that have been around for quite some time. Our genetic world has expanded greatly into many, many more genes that we test for now. So sometimes even patients that have had what we call maybe BRCA testing years ago would qualify for updated testing, to where we would relook at those BRCA genes along with several other genes that we now know of. So this pie graph here, when we look at that 10% of hereditary cancers, that would be people that have a positive gene mutation. If we break those positive test results down, 50% of those patients are going to be positive for BRCA1 or BRCA2, and then the other 50% of those patients are positive for the other genes that we have on the panel, which I'll also talk further about. Those additional genes hold a high risk for breast cancer, but also other cancers as well. So it's focusing on the BRCA1 and BRCA2 genes, since about 50% of patients with a positive gene mutation will have one of those genes. Those hold a high risk for specifically breast and ovarian cancer are their highest risk. Also male breast cancer, prostate cancer, melanoma, and pancreatic cancer. A lot of people ask, what would happen if I find out I have one of these gene mutations? And it varies greatly, specifically with these BRCA mutations. A lot of times we see people go as big as having big prophylactic surgeries, maybe such as a bilateral mastectomy or preventative complete hysterectomies. Other times patients maybe just amp up their screening as far as with like an annual breast MRI and different things. We specifically focus on this testing when we have a patient with breast cancer, because this might help guide their treatment as far as surgically what they want to do. It would greatly change their surgery decisions if they found out they had a gene mutation that caused their cancer, because they would find out that they are also at high risk for developing possibly another breast cancer and other cancers down the road, and might be more aggressive with their surgery treatment. With that in mind, this testing is very important for people that don't have cancer, because if we have ladies in our high-risk clinic who have come back with these gene mutations without a cancer diagnosis, but they may be having a very similar surgery as one of our breast cancer patients in a prophylactic way. So how genetic testing can impact you. Out of just the breast cancer realm, Cancer Next is a basic panel that we do for the majority of our cancer and just high-risk patients. So it's got BRCA1 and BRCA2 on it, but it's got about 36 genes, and these are all related to hereditary cancers.
I do have a question.
Yes. Yep.
If you're the first one in your family diagnosed with a specific rare cancer, is it recommended to get genetic testing?
Yes. So it makes the most sense for the person with the diagnosis to have the genetic testing, because the way that it works is if that person were to be positive, then there would be a 50% chance they could pass that gene mutation on to their children. They would have had to gotten that gene mutation from mom or dad. So therefore, if their parents were still living, their parents should get tested, and siblings and such as well. If they had that rare cancer and they tested and they were negative and they had no other family cancer history, then it wouldn't really be important for the rest of their family to worry about getting testing done. So that kind of, if that specific person with the cancer could be tested, that is ideal, because then you can kind of rule out the need for anyone else in the family to have testing. Of course, there are situations, unfortunately, where maybe that person has passed on or just doesn't want to do the genetic testing. And then that's where you kind of open the big Pandora's box of everyone in the family needs to get testing to rule that out, since you're not sure if that main person has the gene mutation or not. Any other questions, or just that one for now? So back to that Cancer Next panel, that's our basic cancer panel that we order for most patients. We do have a company here at Unity Point that we use for the majority of our genetic testing. They're called Ambry Genetics, and they are based out of California. There's only actually a few companies in the country that do this specific type of genetic testing. So this is one that we have found to be very up to date with the latest science, and also they have become very affordable for patients to have the testing done as well, which is a huge question many patients have. Your test results, what I kind of explain to patients is if you do this genetic testing, we'll sort of cross that bridge when we get there as far as what the specific recommendations for you would be based on your results, because with those 36 genes, every gene is very specific as far as what cancers they put you at risk for, how high your risk is, and then because of that risk, what are your recommendations? And kind of like what we have listed here, that can lead anywhere from maybe amping up your screening. So maybe if you're under the age of 40, we recommend you have screening mammograms before the age of 40. Same thing with screening colonoscopies, having them before the age of 50, and then doing things maybe every 6 months or yearly for screening that you wouldn't normally be recommended to do based on the fact that you're considered higher risk because of a gene mutation. And then a lot of people have questions as far as insurance coverage. And if you have a known gene mutation putting you at higher risk for certain cancers, then insurance does recognize that, and it will start to pay for high risk screening. That way you can do the screening that's recommended for you, and it's covered by insurance based off of that gene mutation. So just to kind of trace back around with genetic counseling, if you came into Unity Point here at our high-risk clinic, it would be meeting with one of us nurse navigators and one of our nurse practitioners, most likely here in our clinic, to discuss your specific risk. We evaluate actually a lot of patients for their risk for breast cancer, just because we are specifically in the breast center. We do know that many family histories have nothing to do with breast cancer. And in that case, we would maybe go down the path of the colon and the pancreatic cancer and things like that. But we would assess your risk, identify based off of your family history if genetic testing is something that's reasonable for you. And then, of course, talk more logistically about what that would look like and how that would be covered by your insurance. So when you meet with us to discuss the genetic testing, the most important thing is to have a semi idea of your family tree. You don't necessarily have to have everything written out, but the most important things to know are anybody in your family that have been diagnosed with cancer, roughly the age of their diagnosis. And this pertains to cousins, brothers, sisters, parents, aunts, uncles, grandparents. We do look into great grandparents a little bit. Once we get beyond that, it gets a little bit too far out for family history. We do have some patients that will come in and have a huge family tree, and not that it's not important to know your great and great aunts and uncles, but once we get too far removed, it makes it harder to kind of narrow things down to see if you are a candidate for genetic testing. So mainly first and second degree relatives to have an idea of that family history. That also brings me to, we have some patients who are adopted and say, I'm adopted and I have no idea, anything about my birth parents or my family history. In that case, sometimes insurance does recognize if you're adopted and you want to do hereditary cancer genetic testing, some insurances are actually paying for that now simply by the fact that you're adopted and you have no idea what your family history is. So that's always something to keep in mind for our patients as well. So circling back around to that genetic counseling appointment, we would review your cancer risk for not only you, but also certain family members, go over that family history, or if you have no family history and it's more of your personal health history, of course, then we'd go by those guidelines. We talk a little bit further about what the genetic testing entails. Some patients will have a question for us as far as like, well, why would I do this? Why do I want to know the results of this if it's just going to maybe scare me and make me worry about getting cancer every day for the rest of my life? And it really is a very personal decision to think about for patients for genetic testing. In our eyes, we find it beneficial for patients because if you find out you are at higher risk for certain cancers, luckily there are a lot of things that we can do nowadays to maybe take your risk from higher from the general population down to lower than the general population because of maybe big preventative surgeries that you might do, or at the very least, I explain to a lot of my patients that knowledge can be power. So if you know that you're at high risk for certain things, maybe like colon or pancreatic cancer, specifically, I should focus on pancreatic and ovarian, where unfortunately they're diagnosed many times at later stages because the symptoms mimic symptoms of a lot of other routine problems that we have. If you know that you are at a higher risk for those cancers, you might pay a little bit more attention to things that aren't feeling right, or something that's just off that we might normally brush off and ignore. If you know that you are at this higher risk and carry this gene mutation, it might prompt you to seek medical advice or attention from your doctor sooner. And therefore, knowing that you have a gene mutation certainly can't keep you from getting cancer, but many of these cancers can be treated and curable if it's something that we find in very early stages. So that's kind of how we speak to our patients as far as the benefits of genetic testing. There are certain people that this isn't maybe something that is reasonable for them because it would just worry them too much, and maybe they don't want to have increased screening and they don't want to think about those things. So it's a very personal decision, not something to be taken lightly. It just kind of depends on if you're the kind of patient that likes to be maybe more proactive and on top of things and know everything that you can, or some people might joke around, they just want fate to take its course and they don't want to know these things. So it's a very personal decision. And I always tell people there's no right or wrong answer. It just has to be something that you decide for yourself. Of course, a big reason some people come in for testing, or even specifically our cancer patients, they might say, I don't really care about genetic testing for myself, but I want to do it for my kids. That's a big thing that we see. So as far as how genetic testing can impact your family, kind of back to what I talked about before, if you yourself are found to have a genetic mutation, then there would be a 50% chance that you could pass it on to your children. So therefore, your children would be candidates for testing. If you have siblings, there'd be a 50% chance that they would have the gene mutation. So they would be candidates for testing. And then, of course, parents, if both parents are living, and we're interested in testing, then they would qualify to have that done as well. Another question I have from a lot of patients is, if I have young children, maybe let's say 9 or 10 or something like that, should they have testing done? And luckily, a lot of these hereditary cancer genes don't really affect childhood cancers. They're more cancers later in life. So usually for most of our specific testing, we don't test patients until they're 18 years of age or older, because there's nothing that would change. We wouldn't recommend screening anybody at the age of 14 or 15. We certainly wouldn't recommend any big preventative surgeries for anybody at that age. So usually 18, when a patient is considered an adult and can make their own decisions, is when we would look into having that testing done for them. Also to note, the company that we use, Ambry Genetics, they do have a 90-day promise. So if you had testing done and were found to have a gene mutation, any first degree relative of yours could be tested specifically. Maybe if their insurance didn't pay for that full big panel that we talked about earlier, the company would pay for them to do what we call single site testing. So let's just use the example of the BRCA1 gene. If as a patient you found out you had a BRCA1 gene mutation, then the company would pay for, within 90 days, for any of your first degree relatives to have that single site testing and be tested for that gene mutation. So if people didn't have insurance, or they didn't want to bill their insurance, or however that looks, they could be tested just for that single site gene that is known in their family, and it would be a covered expense. Of course, you would have to provide a copy of your genetic results specifically to that family member to bring to that appointment. But that is also another reason we use this company, because it helps patients kind of reach a wider range of their family that would be important to look into getting testing done. Yes, yeah, it's very nice. And we've had a lot of patients that have taken advantage of that too. So, and also a big question, which I have here too, people have the misconception, especially with breast and ovarian cancers. Women might say, oh, I have this gene mutation, but I have sons, so it doesn't really matter. And that is false. These gene mutations do not discriminate male or female. So you have a 50% chance of passing it on to sons, just like you do to daughters. And back on our previous slides, when we had talked about the risk, the BRCA mutations, yes, have a specifically high risk for breast and ovarian cancer, but also prostate, pancreatic, and melanoma. So all of those things can apply to men. Of course, men can get breast cancer as well. It is more rare. That is also, I don't think I mentioned that before, one of those big red flags. If you have anybody in your family that is a male with breast cancer, right there, that's kind of one of those light bulbs that goes off to make us look into see if a genetic mutation possibly caused that cancer or not. So whether you have sons, daughters, brothers, sisters, they would all be candidates for testing because these genes do not discriminate by sex. So they have an equal chance to pass on to either or. And there are 3 possible results. So if you did complete the genetic testing, then usually about 3 to 4 weeks it takes to get us the test results back. We do have genetic counselors that we have a third-party company that we use. So every patient that completes genetic testing here will have an appointment when their test results come in with a genetic counselor. It will be a phone appointment since we don't actually have one here in-house at Unity Point. But that's regardless if you have positive or negative results, you would be set up with a genetic counselor to be counseled about what your results are, what it means, and what next recommendations are. So the 3 results that can come back are positive, meaning you do have a gene mutation. And then, of course, we would talk about the specific gene and what the risks are. Negative, so that just means you have all those genes, they're working appropriately, so your risk for cancer is basically the same as the general population. And then we do have a result that's called a VUS, or a variant of uncertain significance. That one gets a little tricky. The way I describe it to patients is we all have different things in our genes that make us individual and who we are. As of science right now, they're just saying that they see something that looks maybe not textbook on one of those genes, but it's nothing that is concerning at this point in time. But with those VUSs, they do tend to rerun them in the future and reach out to patients if they were to change into something else. Typically, I see those VUSs change from that to a negative result. We don't typically see them turn into a positive result. So it's usually nothing to be alarmed with, but of course, patients don't like seeing that. They'd rather just have completely negative results versus anything that looks off. But it's just made to be a point of that we all have different things on our genes making us, who we are. So it is nothing to be concerned about. There are no doctors that would recommend different screening for you based off of a variant. There are no doctors that would take you into the OR for a big preventative surgery based off of a variant or anything either. So they are considered negative, but it is something that we do see often on those test reports. And of course, a big question everybody wants to know, does my insurance cover this testing? We've come a long, long way actually in the genetic testing world with insurance coverage with the Preventative Care Act. A lot more patients are getting this coverage, and that includes Medicare, Medicaid. Most of those actually do cover this. Of course, you would have to come in to be evaluated, and back to those 5 bullet point questions. If you're meeting those guidelines, then usually I can tell you, yes, insurance will most likely cover this. We do have a contract with Ambry, the main company that we use for this genetic testing. So they're very good at doing all the pre-authorization with insurance. So they look into a patient's coverage, and I would say probably 9 out of 10 times, if patients are meeting those bullet guidelines, then insurance covers it in full and patients don't pay anything out of pocket. If insurance does not cover it, it's actually quite affordable, more than it was years ago. So it's about $250 out of pocket. And the company we use has payment plans. They have financial assistance that certain patients qualify for too. So I've had patients who maybe don't even meet guidelines, but they just really, really, really want to have it done. And I usually tell them, most of our doctors in our clinic are okay with doing that testing if it's something somebody's concerned about, knowing that insurance most likely won't cover it, and then they will pay that $250 out-of-pocket expense. This is something a couple of years ago when we were doing this was closer to $2,000 out of pocket. So of course we didn't have many patients wanting to pay that price or having the funds for that, where nowadays we have more people paying out of pocket if insurance does not cover. I have our phone number on here for our Unity Point High Risk Clinic. So I have some of our cards here too that I can leave down here at Gilda's Club. And I also have some handouts. Sometimes it's just nice to look specifically. I would name off all the genes that we test for, but I would probably bore everybody to death here. So we have handouts that list specifically the genes that we test for. It has check marks as far as these genes and which cancers they're associated with. So sometimes this is something that people would like to have as a guide. So I'll leave some of them down here at Gilda's Club for anybody that's interested, along with some of my cards. You don't have to have a doctor's referral to come into our high risk clinic to talk about genetic testing. You can do a self-referral. So it would be a phone call just saying you would like to do a self-referral to further discuss genetic testing. The day that people have appointments to discuss genetic testing, if they do qualify, it is a blood draw that we do. So if you came in that day and qualified and wanted to proceed, it is something that you could do that very same day. Of course, nobody is obligated to do it. If you learned more about it and decided that you didn't want to proceed, then it certainly wouldn't be something that you would have to do that day. I just have a couple resources here that are some good websites to check out if you have more questions regarding genetic testing. Also, we're a good resource here too in our high risk clinic if patients want to call and just inquire a little bit more about it, or if it would be something beneficial for them or their family to complete. So that's kind of the basic rundown I have. Certainly if there's any questions or anything else that I can go into, I'm more than happy.
And I'll give the Zoom people a
Sure.
moment if they're typing in any questions, but
Okay.
I want to thank all the Facebook people for joining in, and I'll end the Facebook Live.